So the correct diagnosis is D, Dandy-Walker malformation. So let's look at some of the features that makes choice D the best answer here. In this fetal MR and this postnatal MR, you can think of Dandy-Walker malformation comprised of three classic triad of findings. One, you have a hypoplastic vermis, sometimes aplastic. You can see that in this postnatal MRI as well as in this fetal MRI pretty well. Usually it is abnormally upturned. Also, you see this marked cyst expansion of the fourth ventricle extending into this large posterior fossa cyst or Dandy-Walker cyst, which in turn will cause enlargement of the posterior fossa and elevation of the tentorium. Remember, the normal tentorium is slanted about 45 degrees this way, and also because this abnormal elevation of tentorium, you have the elevation of the torcula, which is a confluence of the venous sinuses. Normally, that's positioned below the lambdoid suture, but in this case, this abnormal elevation causes it to be positioned superior to the lambdoid suture, therefore causing this so-called torcular lambdoid inversion. So these three classic findings make Dandy-Walker malformation the best choice. Okay, let's look at the wrong choices in this case. So for choice A, Blake pouch cyst, this is an example of Blake pouch cyst. As you recall, Blake pouch is an embryologic structure that envelopes to form a future foramen magendae. If you have a persistent Blake pouch or Blake pouch cyst, there will be obstruction at foramen magendae of the CSF outflow. So typically, Blake pouch cyst patient will present with some degree of hydrocephalus. That's also true with Dandy-Walker cyst. That also does not communicate with subarachnoid space. Therefore, Dandy-Walker malformation patient also presented with, or typically presented with, hydrocephalus. But the key difference is that Blake pouch, you should never see enlargement of the posterior fossa. Also, the vermis usually is fully formed or just mildly hypoplastic, unlike Dandy-Walker cyst. Therefore, this, or I should say this case right here, is not the picture for Blake pouch cyst. Here you can see there's an example of a lobar holoprosencephaly. The first thing that you should notice about holoprosencephaly is that there's absence of septum pellucidum. Also notice that there is a partially formed corpus callosum, and the posterior aspect of the corpus callosum is fully formed or relatively well formed, but the anterior aspect is not well formed. Remember, the division of the brain hemisphere is coming from posterior to anterior and superior to inferior. Therefore, the last place to divide would be the anterior inferior aspect of the frontal lobe. So the posterior aspect of the corpus callosum may be well formed in the setting of semi-lobar holoprosencephaly or lobar holoprosencephaly, but the anterior part remains fused. So this is a picture of holoprosencephaly, not a picture of holoprosencephaly in our case. So the overall D is the correct answer. If you have any questions, please let me know. Good luck on your exam.